So, I guess I was about 21 when I had a bipolar event for the first time. I had a lot of stress in my childhood. I had my ears done. That was like PTSD and stuff, and then a divorce between my parents, and they pulled me apart. Kent said I was their pawn. But anyway, so stress in childhood and then genetics. And they put me on lithium and I wouldn't take it. And then I got pregnant because my parents' divorce was so tough. I decided, I guess, to have my own family. So I kept the child and I was on medicine and I did pretty good and I got married. Anyway, and the divorce came and the lithium caused my thyroid to have problems. So I went through a number of medications over the course of 10 years. And Dr. Gray put me on all different kinds of medicines, but I was in and out of hospitals, costing the taxpayer a bunch of money. Sleep was a huge deal, a lot of problems, benzos, things like that, high levels of Seroquel. It was really scary, and I wouldn't sleep, and then I'd end up having anxiety and panic attacks, and I had to go in the hospital. They did ECT. I mean, I think I had like probably close to 8 or 10 hospitalizations per year, maybe 5, over 50. I've had over 50 hospitalizations, a couple suicide attempts. My kids like having a mother. I'm an artist. Guess, reasonably smart. But finally, Dr. Gray said, I can't be your doctor anymore. And she kind of sent me out in the wide blue open. And I went, thank goodness I went to, for my work, I'd gone to Disney. I drove across country. And then I went to the Seattle thing. I went to the Gates Foundation to try to get financing for World Preschool. And I guess when I was in LA, I met Johnny Depp and went to I'm an artist, it doesn't really affect my work so much, except I couldn't do menial jobs, like just going in and being normal. As an artist, it really didn't affect my work that much. An artist can be an artist. So I was losing my house. My daughter moved out. I was really at my wit's end. I said, this has got to stop, the sleep problem and stuff. And so I went to my doctor at the Daily Planet, Petticelli, and he had been a prison doctor. And he said, well, you'll need to check in for a couple weeks, but I'm going to put you on clozapine. He said, I know that'll work. They use it in Europe. They don't use it that much in the United States. I did not want to go in the hospital again. This is just another hospitalization. But I looked at him, I said, okay, I'll check in. Apparently I wasn't a danger to myself and others, but it was pretty miserable living with these manic symptoms. And not as much depression, but mainly uncomfortable, not sleeping and things like that, and really trying to control being angry, things like that. And so I did check in, and I haven't been in the hospital since. It's been 3 years. And I'm able to maintain just a normal, steady, Joe Schmo kind of work. I've been through working at the Kroger, and then I moved out to Petersburg, and I got a job at the Food Lion. I'm Walmart, now I'm at the ABC store. And I have a surprise job, if I get it, that's just going to please everyone. Just everyone. When I get this job, it's going to be fun. But we need better psychiatry, because Petticelli left and they put me with a nurse practitioner, and I've been trying so hard to get my blood drawn. Finally, we got it done, but he hasn't been doing my lithium levels, and I had to tell him, I'm like, I'm supposed to be getting my lithium levels. People, are you trying to kill us? Seriously, is this like a mass grave of like the people's families that don't have money, and you're just dumping us in because you're mentally ill and poor? I'm getting a little tired of this, because I meet up with all these people that fairly reasonably intelligent, and their medicines aren't correct. They can't hold a job. They can't dress themselves. You pretty much just put them on the street from Central State. I'm getting a little tired of this. And it's not the right way to treat an American citizen whose family has paid taxes They don't deserve, they're ill, they're mentally ill, and they deserve a place to stay and a place to recover and a good doctor, just like anybody else. Ethics involved, you don't know what you're doing here. What are you doing to this person, their family, by not treating their illness? I'm not happy with this. And I won't go into past residences, but I have been in different places in this country. And I will have a say about this, and I hope you do the right thing. Thank you.